This hangout is live. This hangout is live, and this hangout is live officially. And welcome back, everybody, to Sports Crunch with D. Crom. I'm your host, David Cromwell, and we are. It's that time of year again. NFL training camps are just 2 weeks away, and that means it is time for us to start preparing for our fantasy football league drafts. And there are countless details that can help give you a leg up on the competition in your league. And one such important detail is injuries. And our special guest tonight is the man to talk about injuries with. A pediatrician by day, Dr. Jene Bramel is a staff writer for the renowned fantasy football website footballguys.com, and his advice and opinions on medical issues in football are sought by notable people in the NFL community, such as ESPN football injury expert Stephania Bell and none other than Adam Schefter. You are also highly encouraged to check out the Audible podcast. The Audible, the name of the podcast. Gene takes part in every Thursday night with Football Guys colleagues Cecil Lammey, Sigmund Bloom, both of them who were previous guests on the program, and Matt Wallman. And without further ado, it is a pleasure to welcome Gene to the show. How are you doing, Gene? Thanks for joining us.
I'm doing very well tonight, David. Pleasure to be here. Thanks very much.
You're very welcome, Gene. And now let's get started here with a guy who obviously would have been a consensus top 3 pick in fantasy drafts if it weren't for a torn MCL and PCL, Steelers running back Le'Veon Bell. And recent reports suggest he will be ready to go for training camp. How would you read into those reports as of right now?
I think it's seeming more and more likely that that's the case. Bell himself kind of confirmed for us that it was both MCL and PCL. We had a report from Jason Lockenfor very early on in December after the injury that was the case, but it hadn't been confirmed by Bell. It hadn't been confirmed by the team, and Bell has recently confirmed that. And I think it made sense, just the rehab time involved and everything coming back. My concern with him is I'm not convinced that this is not his first PCL injury. That hyperextension that he had in late 2014 could have been a similar injury. And PCLs are always tricky, especially when they involve or are involved with another ligament injury like the MCL, because the knee is unstable in a couple of different directions. However, we've seen, like so many other players already this offseason, Bell's been posting videos on Instagram relatively regularly, showing that he's moving pretty well. He seems to be pretty confident. Little bit of a mental concern he mentioned earlier this month about whether or not and when he's going to be able to come back. But all signs seem to point to him avoiding the PUP list and being ready to go. That's no guarantee necessarily, but I think if we see him start camp, it's going to be a very reassuring sign. If we don't, we're going to have to pay very close attention to what we hear from him in those first couple of weeks, and that'll give us a better indication of whether or not he'll be ready to carry a full workload in week 1.
Most definitely. And the thing I was personally curious about was I've heard in medical jargon that torn MCLs are even more difficult to treat and repair than torn ACLs. And is that true? And if so, why is that the case?
Yeah, I don't know if that's the case necessarily. It's unusual for an MCL to be repaired when it usually is just allowed to scar down, remodel, and heal. When it is repaired, it generally means that instead of the mass of the ligament in the center itself being ruptured, that it's pulled off the bone with a piece of the bone, or a fragment of the MCL is kind of flipped into the joint, and that needs to be pulled out of the joint and repaired. So it's a little bit of a technical challenge to do some of those things and make sure that the knee is stable in that direction. But the MCL isn't necessarily a primary stabilizing ligament of the knee like the ACL is, but it does come up with its own pitfalls with rehab and what have you. But generally, it's a situation that can be rehabbed well from. It's a situation that isn't needed to be taken care of surgically. I think the big deal in Bell's case is that it was a 2 ligament injury. Both of them were likely repaired. Lots of times the PCL won't get repaired either, but it is generally repaired in any situation where there's more than 1 ligament injured. So he had 2 ligaments repaired. Whenever you're dealing with a multi-ligament injury, there's some concern there. So in this case, I would say that the MCL injury is a important factor, especially if there are other things that we didn't hear about, be they cartilage or otherwise. But again, at this point, regardless of what that injury is, what we're waiting and watching for is to see how he recovers, make sure he avoids any compensation type injuries, any cascade type injuries, and those questions are going to be answered fairly soon.
They sure will. And one final question about Le'Veon Bell. Based on what we know right now, where do you currently rank him on your draft board?
Yeah, I think he belongs in that top tier. I think you have to have. My general answer to this question is it depends on your personal drafting philosophy. If you are willing to take risk, if you are willing to take an injury-related risk, and although we haven't heard a lot of talk about Bell fitting into that quote-unquote injury-prone category that I dislike so much, I think that that's where it lies. If you are comfortable taking the risk that a healthy Le'Veon Bell is a top 3 overall player, then maybe you go ahead and take that risk. If you're drafting this time of year, those are just, you're going to be dealing with incomplete information, and those are decisions you have to make. If you are not comfortable drafting players like Rob Gronkowski coming off forearm injuries, or Jamal Charles coming off ACLs in the past, or those sorts of players, then I think you put Le'Veon Bell down at the bottom of that top tier, or you drop him into the second tier. I'm not too worried about him at this point. We've seen him recover from significant injuries, be it the foot sprain in his rookie year or last year, that knee hyperextension, fairly well and do well. Can you bet on him to play 12 to 14 games? It's hard to say right now. You're just dealing with that little bit of incomplete information. I would not have him outside my top tier at this point. Whether or not I went Gurley, Bell, or one of those other players in the top tier just depends on risk tolerance for all of those players, depending on whether it's Todd Gurley still not necessarily proven himself behind a top offensive line, or Bell dealing with injuries, or any of the other guys in the same tier.
Yes, I completely agree with that. And moving on to our next question, another bold, notable player coming off injury is Packers wide receiver Jordy Nelson, who suffered a torn ACL in the preseason last August. And although there weren't any other additional ligament or cartilage damage, Nelson is also 31 years old, and he also had hip surgery last offseason before blowing out his knee. How much concern do you have given his age and the fact that he's had numerous other health issues in his career?
Not much. I think we've seen multiple times that receivers that seem to be a little bit up in age, into their low 30s, do just fine. ACLs in isolation, those players have a higher risk of tearing that ACL again, higher risk of tearing the ACL in the other knee. So he's not without risk. I don't think that the hip problem he had last year is a major contributing factor. I don't think that's a likely reason for why he had the knee injury. And by all accounts, he was ahead in his rehab from the beginning. He was already running and cutting in November last year, and he's had another full 8 to 10 months to recover. So I don't have an injury flag on him much at all right now. I think he can be considered without injury risk, at least from recovery standpoint from last year. No reason to expect him to struggle with that this year.
That's very good news, especially for Packers fans and fantasy owners of Aaron Rodgers and obviously Jordy Nelson as well. But would you, based on what you said, you wouldn't mind drafting him in round 2 in 12-team leagues?
Yeah, I think some of the rate limiting factor there is we didn't see Aaron Rodgers have a great second half of the year last year. Was that injury related? Was it ongoing offensive line problems that he had been able to make up for in the past? Was that the fact that he had wide receivers that were struggling to separate while he was dancing around in the pocket? Was it the fact that they didn't necessarily have a consistent sustaining rushing attack? And I think hopefully a lot of those questions are going to be answered this year. But a healthy Jordy Nelson with a healthy Aaron Rodgers with any sort of protection has been a very, very valuable player. So yes, I think he's worthy of consideration in the late second round, early third.
Most definitely, and that'll be something to watch for very early in the season and preseason as well. And moving on to torn ACLs, and you alluded to one of these players earlier, it is very concerning to me personally when a player suffers multiple torn ACLs in a career. And two such players, Jamal Charles and Tyrann Mathieu, who was, in my opinion, the Defensive Player of the Year last year, are coming off each of them the second torn ACL of their career. And how much of a concern is it to you when a player tears an ACL for a second time?
I think it has to be a concern, but we've seen multiple players now because the first ACL rehab and recovery is going so well, and we know that there's a 10 to 14% chance of one knee or the other having a ruptured ACL in the future. We're going to see more and more and more players who have second and unfortunately 3 ACL tears as well. Thomas Davis fits into that category, and there's some other players as well, and they all have done fine. Now, the other nice thing is that we're talking about elite talent. So if maybe they lose a percentage or two off of their full form prior to the most recent injury, maybe doesn't affect them quite as much. It's hard to say for certain until we see, but again, isolated ACL injuries, even if they're repeat ACL injuries, have not been a career death sentence at all. And until they prove to us otherwise, I'm not too worried about Jamal Charles or even Tyrann Mathieu going forward. I'm
personally very glad to hear that, rooting for both of them to have a good year. And first of all, in terms of Charles, how high would you consider drafting him? Not just because of the injury, but also because the Chiefs are planning to involve Charcandrick West and Spencer Ware more.
Yeah, I think that's the primary issue is how serious are they about involving West and Ware, and at what point of the field are they going to do that? I don't think that we're likely to see Charcandrick West take a lot of passing down snaps. I don't know how much Spencer Ware will be involved at the goal line, but I think those are the concerns. If they're serious about that, and no one really is ever sure exactly what Andrew Reid is serious about and what he isn't, if they are serious about that and it does take a game or more worth of touches over the full season away from Jamal Charles, then I think that's something you have to be concerned about. But again, that's something that hopefully we'll get a little bit more of an indication as we go through camp. It sounds like they're definitely planning to ease Charles into camp. Might not be completely out of the range of possibility that we don't see him at all in the preseason, knowing that they want to keep him relatively comfortable in the hopes that they can get him football ready just in camp practices rather than putting him at risk in a game. So that's going to be another situation that we're going to have to watch and address carefully as the preseason moves along.
Absolutely. And you are one of the top-notch experts when it comes to individual defensive player leagues or IDP leagues. And based on Tyrann Mathieu's recovery so far, would you still consider putting him in your top tier of defenders regardless of position in those types of leagues?
Yeah, and I think that has more to do with strategy than injury. I think a healthy Tyrann Mathieu is about as good as it gets, as you've said. The peripheral stats, the passes defense, the interceptions, the touchdowns, those things in addition to his tackle counts are very attractive. So the safety position is a little bit deeper this year than it has been in the past. There's a number of guys to choose from. Maybe that works in Mathieu's favor for you, that you're willing to wait a couple of extra rounds and take the risk on him then. But I don't feel like, unless you're going after Rashad Jones, that you have to reach for a defensive back this year. So you may as well wait and see what happens. And if Mathieu doesn't work out, there's going to be players as the season goes along that you can add to your roster and still have an impact for you.
Absolutely. He is Dr. Jene Bramel of footballguys.com, ladies and gentlemen. And moving right along here, we go to the AFC East, where two notable wide receivers are coming off rather serious foot injuries, Julian Edelman and Sammy Watkins. And I'm a little bit behind on my knowledge in these departments, but to your knowledge, did they suffer the exact same foot injury? And if not, explain.
Yes and no. So I think the injury is the same. It's a broken fifth metatarsal. The way that these injuries happen were a little bit different. Sammy Watkins sounds like he had a stress reaction that became a stress fracture that they tried to rehab and heal and weren't successful in doing so. Julian Edelman had there may have been a stress reaction there as well, but he had a broken bone as he made a cut and as he was landed on with that injury. And it's also been a little bit different. Well, I'm not really sure exactly what's going on with Sammy Watkins. I think there's been some indication that he may have had a setback in his rehab and it's been prolonged a little bit. But Edelman has already had a revision surgery where they've revised the screw that was there. So it's the same structural anatomic injury, but the circumstances surrounding both are a little bit different.
Very fascinating. And to my knowledge, this was the same, if not a very similar injury that Kevin Durant had a problem with in 2014, correct?
Yes, lots and lots of players. I think it has to do with the footwear. It has to do with lots of different things. But this injury is becoming more and more common over the past 4 or 5 years.
Yes, and as you could say, it's not just in football, it's in all sports. And based on where Watkins in his recovery right now, where would you be comfortable drafting him?
Yeah, I think a lot of that has to do with, Sammy Watkins through the second half of last year, while he was struggling with some of the foot issues and other things. I mean, he had a lot of injuries last year, was a very, very nice player when he seemed like he was healthy, almost to the point where you wonder whether or not with Tyrod Taylor, if he belongs at the very top of that second tier, if not a little bit better. I've seen some people argue that that's the case. I was curious when he said he was still in a boot 6 to 8 weeks after he had the procedure. It makes you wonder if they decided to rehab him in a little bit of a different way. We saw him on Instagram do 25-yard sprints about a week or so ago, and that's definitely reassuring, but we haven't seen him cut yet. We haven't seen him cleared for contact. Seeing all of these players do what they're doing on Instagram does not mean they've been cleared for contact. It doesn't necessarily mean that that's right around the corner for him. So he's got to clear that hurdle, so to speak, before we can fully expect that he's ready to go. The expectation all along is that sometime during camp, he's going to come back. He's going to be ready for week 1. 1, that meshes pretty well with the kind of the 10 to 12 week recovery within that 3-month time frame. The surgery was at the end of April, so you'd expect him to be back sometime at the end of July. If this drags on in midway into training camp where he's still on the PUP list, if that's where he starts, then I think it's time to get concerned. The big issue with him, as with so many other these players, is they've got to come back and get in football conditioning, and when they do that, they've got to avoid hamstring, groin, quad, calf, what have you, those type of injuries.
Absolutely, and that is definitely a timetable I will be paying attention to. And now on to Julian Edelman. There was a breaking story several weeks ago that he's now out of his walking boot. So based on that news, how high would you rank him at the moment on your draft board?
Yeah, he really should have been out of his walking boot within just a couple of weeks, 2 to 4 weeks, depending on how long they want to keep him non-weight bearing afterwards. So that's not so much of a surprise. The difficulty with Edelman is we're not going to get any information out of New England. We'll see him when we see him, right? And like so many of these other veterans, he doesn't need to build up any rapport with Tom Brady. We know what he can do now with Tom Brady being suspended for 4 games. Maybe you'd like to see him get in there a little bit sooner with, with the backups there, including Garoppolo. But I don't know that we're going to know the answer to that. We saw him recover in a relatively expected fashion toward the end of last year. They gave him the 8 to 10 weeks. He came back and was relatively productive. You would expect that to be the case as well. The surgeon that does most of these procedures has a high success rate. Most players come back in some form or another. And Edelman's surgery, even though he had a revision procedure, the most recent procedure was early May. So like Sammy Watkins, you would expect to see him sometime in camp and be ready for week 1.
Absolutely. And let's go on to another wide receiver, and it's Shaun Geoffrey. He was red hot last year when he was healthy, that is. He missed 7 games with soft tissue issues, and those soft tissue issues are probably a big factor why he will probably be forced to play the year on the franchise tag, as reports have suggested that a long-term deal is highly unlikely to be reached between him and the Bears by Friday's deadline. And give us an insight as to what the Bears will or should do to help him minimize those problems from lingering this season.
That's a good question. What we don't know is exactly where in his hamstring the problems were, where in the calf his problems have been in the past, whether or not he's got any scarring, exactly what the risk may be for him, whether or not he's got differences in one side versus the other. It's going to be tough to tell how things are going. But I can tell you this, certainly Shaun Geoffrey is at the top of the list of players that you do not want to hear hamstring, calf, any sort of soft tissue injuries in his legs as we go through camp.
Most definitely. And also Jason Cole, a Bleacher Report, reported that also one of the things that makes the Bears hesitant to sign him was that he, even though despite he signed the tag, he held out of OTAs and trained on his own. And that really supposedly angered the Bears. So how much concern, how much is the Bears' concern justified that he trained on his own and not with the team?
I think that depends on the player. I don't trust anything that comes out of the Bears camp, injury related or otherwise. We just, we know that they're not going to give us a straight answer on these things. I'm sure they would have liked to keep him under the watchful eye. Maybe he trained with the Bears all last year and he still had trouble. So we've seen players like Arian Foster seemingly do really well with outside training and then struggle. Lots of players have done it over time and done fine. We don't always hear about who is and who isn't training with the team. Lots of players train outside the team in the off season and only come back during OTAs and mini camp and training camp. So, the rubber's going to meet the road when we see how he does over the first couple of weeks. And if we get a pulled hamstring early on, then, I think that's a you would hope that Shaun Geoffrey, knowing that he's got another contract coming up, has taken every step he can and is going to be as close to good condition as he could possibly be in. But again, football condition is different than cardiovascular condition. You need to be in cardiovascular condition to play the game, but being ready to take hits from unnatural angles and unexpected angles and be able to, the stop-start motion and everything else, really difficult. Almost, it just can't be replicated no matter what you try to do, how creative you are, how innovative you are with your off-season training regimens. You need to be hit. Those things need to happen for you to be truly in football condition.
Most definitely. He's Dr. Jene Bramel once again, ladies and gentlemen, footballguys.com. And sorry, I misplaced my comments here. How high would you draft Shaun Geoffrey currently?
I think he belongs in that second or third tier. Again, somewhere in that second to fourth round range, I think makes sense. I don't know what his current ADP is, but somewhere in that group. Again, I think, if we're putting injury risks on players, we know what his recent history is, and I don't like to necessarily ascribe past history to the future, but knowing that a player has had multiple injuries to the same muscle and to the same types of muscle groups in the lower leg, I think you have to be a little bit concerned about those things. It'd probably bump him down to the bottom of that tier for me, but I wouldn't fear him too much, depending on what you're looking at as your draft progresses. If you've got a few high floor players that you've already drafted and you want to go ahead and take a chance on the higher upside of Geoffrey, that probably makes more sense than drafting Bell and Charles and then coming back with Watkins and Geoffrey at that point. If you've got, if you're stacking risk upon risk, maybe that's a situation you'd like to avoid.
I completely agree. And also to add to what you said, I feel a lot of sympathy for those beat reporters here in Chicago, where I'm based, and also in the New England and Boston area, because they're definitely not getting any straight answers from either of those teams regarding injuries. And no reporter, not even Adam Schefter, is going to have a clue. So that's why all of you fantasy owners out there have to be very careful with whatever comes out of the Bears and the Patriots. And moving on to another player who is probably going to be out for the first couple weeks of the season, and that is Tyler Eifert, who was one of the most productive fantasy tight ends last year. And the Bengals website just had an interview, I believe, with one of their front office executives saying that it's now a virtual certainty he misses the first 2 to 3 weeks of the season. And what should we expect out of him when he comes back?
Hopefully that he's back to where he was in the past. I'm surprised that we haven't heard. Well, maybe we have a little bit. The injury-prone tag applied to Eifert as well. The best case scenario for him was really a 3 to 4 month situation. We've seen players, Cam Newton chiefly among them, who said that sometimes it takes 4 to 6 months to start feeling a little bit better. The rehab generally goes pretty smoothly up to that 3 month time frame, but the ankle, it's a small joint that's taking a lot of weight bearing on it, especially when you're talking about moving laterally, exploding vertically, all of those things that Eifert needs to do to be successful. And that range of motion and working out that last little bit of pain in that joint has to happen for him to be effective. And so, like so many other injuries, it's that last stage of rehab that's the primary hurdle to overcome. So you hope that we see him get off the line effectively, separate, be able to get up off the ground in high point balls in the red zone, the things that make him the valuable fantasy player that he was last year. With all 22, with hopefully some beat writer reports that tell us how well he's moving, we'll get a sense as we get closer to that 12 to 16 week range, which is getting pretty close to week 1, how close we are for him to be, are we talking week 2 or are we talking week 5? He's going to start on PUP. And the big determination is probably going to be, does he start the regular season there? And that's, the Bengals, like the Bears, aren't going to get any information. I think it was probably a little bit of a slip from Tobin when he said, look, we don't really expect him to have him for the first couple of weeks of the season. So that's already telling you that they're planning to be without him. They're game planning to be without him. And if you're going to be without him the first couple of weeks, and that as you get closer to the season, maybe they decide that they want to be a little bit even more cautious with him and keep him on PUP to start the season. That's getting well into the speculation side of things here. But I think, we got to listen very carefully to what little comes out of Cincinnati to be able to determine whether or not this is a week 1 injury or a week 4 or 5 injury.
Yes, that's going to be a very interesting development to try to detect. And if, let's say, somebody tries to bite the bullet and take Eifert in round 7, 8, or 9, what are some great tight end handcuffs they should look at to compensate?
Yeah, I think the ones I've been looking at most often, depending on where Coby Fleener goes, depending on what you can get from Martellus Bennett. I mean, I think you're looking at guys in that range where you want somebody that, you're not necessarily looking for a handcuff because you expect that week 1 may be an issue all the way through the season. You're looking for a handcuff to maybe cover you for that first month or so. So you want a guy that's been around the league a little bit, that's likely to build up a rapport with an already good quarterback. Bennett is, again, depending on what happens with the Brady situation, if there's any further appeals, maybe the roses come off of that shine a little bit as well. But those are the guys that I think you're looking at there. There are quite a few others. You're basically just Dwayne Allen would maybe another guy that you throw into that category. Maybe a Jared Cook. Just you're looking to catch lightning in a bottle for that first month of the season.
You are. And another tight end that I personally have my eyes on is Ladarius Green, who was acquired by the Steelers in free agency, but he had some offseason surgery. What's the latest on Ladarius Green, to your knowledge?
Yeah, I think he's another one of these players where the ankle condition is not fully known. Is it a situation where they were tightening up ligaments? Is it a situation where they were shaving down bone spurs? Was it something more than that? I don't think we're going to know. But the Steelers signed him in March knowing that he had surgery in January, and they didn't seem to be too concerned about it. They brought him on board relatively early in the free agency period. And he was not, he was at weight-bearing status early on in OTAs and in mini camps as well. They didn't allow him to practice yet. Part of the rehab, again, this being a 3 to 4 month thing most often when you're dealing with ankle surgeries. So you're just going to have to get a sense of where he is there. He's another player that the first week of camp is going to be very big. Did he go on PUP? Did he not go on PUP? Was he cleared for contact and consecutive practices right away? If he is, probably no concern, again, other than let's make sure that he doesn't have any compensatory injuries. If he does start camp on PUP, then we're probably week to week more than day to day, and there could be some more concerns as we go there.
Most certainly. And also, let's focus on now the wide receivers. As they say, this could be the year that wide receivers are the new running back in fantasy drafts. And like among the consensus top 3 wide receivers are obviously Antonio Brown, 1, and I've seen it flip either Odell Beckham Jr. or Julio Jones at number 2, and whoever isn't at 2 among those 2 receivers at number 3. And given the fact that Odell Beckham Jr. has had hamstring problems these past couple years, does that make you want to put Julio Jones behind Antonio Brown at number 2?
No, not necessarily. I like all of those guys. I think it's very difficult to separate them. Their target counts are the same. The surrounding cast is arguably pretty similar. So I think that's pick the guy that you'd rather root for. Pick the guy that you think is a little bit ahead of the other one. The injury risk. I mean, you say the same thing with Julio Jones, who's had multiple issues with that 5th metatarsal as well. You can nitpick everybody's injury profile if you'd like to.
Yeah, you're most definitely right. And my bad for not being careful about that last time. He's Dr. Jene Bramel, ladies and gentlemen. Footballguys.com, football injury expert in high demand, as you can tell. And thank you once again, Gene, for donating your time and your immense knowledge tonight. But before we part, are there any other injury stories that you will be paying attention to come training camp time?
Yeah, I think there's quite a few. I think, I'd like to see what happens with Jimmy Graham and Victor Cruz as far as patella tendon recoveries go. That's not been an injury where people recover very effectively. We got 2 elite players. We've seen how difficult it is for one of those guys in Victor Cruz to come back last year with the calf things that were undoubtedly related to his recovery from patellar injuries. Jimmy Graham really wasn't being used much in Seattle anyway, so there's some confounding factors here, but it would be nice to have a positive comp to go to if in the future we see a few more of these patellar tendon injuries. Thomas Rawls, I'd like to see him start off PUP. I think this year, you talked a little bit about Jamal Charles yourself. Dion Lewis belongs in that ACL category a little bit too. I think Des Bryant belongs in the same conversation as Julian Edelman and Sammy Watkins does as far as those, those 3rd or the 5th metatarsal fractures. Rashad Perriman is going to be somebody we got to keep a pretty close eye on to see whether or not he eventually requires surgery for the ACL. I think there's probably a good 20 to 25 skill position players that we're going to want to watch pretty carefully to see how their teams feel like they're progressing. Do they start on PUP? Do they not? As we get to the end of July and the first week of August.
Thank you very much once again, Dr. Jene Bramel. You can tell why he is the man to talk about football-related injuries with. And we thank you once again for joining the program, Gene. And you are all highly encouraged to check out the Audible podcast that he takes place in every Thursday night with Football Guys colleagues Cecil Lamby, Sigmund Bloom, and Matt Waldman right here on Google Plus Hangouts. It was a pleasure having you on the show, Gene, and a pleasure to meet you. And I hope to do it again with you sometime soon down the road.
I appreciate it. Thanks for having me on, David.
You're very welcome. Dr. Jene Bramel, ladies and gentlemen. And that does it for tonight here on Sports Crunch with D-Crowd. But we will be back with another edition of our fantasy series next Wednesday night, where another former Football Guys stat writer, Matt Harmon, will join the program, where he will talk about his reception perception theory and what receivers to look out for in the value rounds in your drafts. For Jene Bramel, I'm David Cromwell signing off, saying stay awesome and let's get some football.